Okay, now that we have all got it. We are so grateful for the NTAC National Training and Technical Assistance Center for hosting these family exchanges. And we're so glad that you're all here to participate. This is the topic today is tracking outcomes and matching assessments to programs. And I'm really looking forward to Robin's response or presentation today and what she has to share with us. Now I've got to get my slides to go. This is just the regular disclaimer that all NTAC presentations have, that this is an event that is supported by SAMHSA, but it is part of our the NTAC's work in a contract with SAMHSA to provide this work for you. There is some information in here that is pertinent to Wisconsin Family Ties, and we want you to make sure that that is something that is, if you use any information here, that you cite it correctly and give Wisconsin Family Ties the credit that's due for them. In case there are any problems with this session, Bridget, who is our tech support person, will cut us off and we'll send you an email with some further instructions. I've not had anything happen yet, but I have heard about it, so it's rather devastating. So hopefully nothing happens. A little bit about NTAC and the little overview of them. Here you will see all of the multidisciplinary team that is involved with NTAC, doing all the planning, the technical assistance, the training, and whatever. Of note, there's FREDLA is on the bottom and Youth Move National. So they do follow the guidelines of the system of care, including families and youth. And so we're grateful to be part of this multidisciplinary team with NTAC. So NTAC's goal is that all children, youth, and young adults and families with emotional or behavioral health needs can access evidence-based treatment and recovery services in a well-coordinated system of care. These are the audiences that we present to, or the NTAC presents to. You can see it's a wide variety of people who work in system of care. You all know that as with the work that you do. So we're glad if you have any needs at all for technical assistance in any of these areas, we're more than happy to present to that specific group or a combination, a collaboration in your area. So at the end of the slides, we'll give you that slide, that email, so you can contact NTAC if you are in need of technical assistance. This is, again, the services that they provide are at no cost, and they give a lot of technical assistance and a lot of resources in all of these areas in this circle. And so if you are in need, there's something in there for everyone. So please join NTAC and find what it is that will help your organization be better, do better. Today, we're so lucky to have Dr. Robin Hart Schultz again with us. She was with us at the beginning, or in the February, March, somewhere around there, to talk about evaluation. And we quickly realized there needed to be additional discussion on outcomes. And so that's kind of what she's talking about today. And I'm going to turn time over to Robin to present. So you introduce yourself, please, and we'll go with it.
Great, thank you. I'm so glad to be back again. I firmly believe that these webinars make a big difference for all of us who are working to improve lives, and so I'm thrilled to be a part of it. You mentioned that I presented in February, and at that point I was talking about program assessments. The purpose of that presentation was really to acknowledge that most executive directors are already collecting information. They may not be aware of it. They may not be aware of how to use it, but to really take advantage of what was already occurring within the organization. Today's webinar is a little bit different. We're going to talk about selecting assessment instruments or tools that are good matches for your programs, and in particular for your parent-peer specialist programs. So that's the focus for today. And if you could switch the slide for me.
Okay.
A little bit about Wisconsin Family Ties. Obviously, we're located in Wisconsin, and our mission is to change lives by improving children's mental health. Our hallmark program is the Parent-Peer Specialist Program. We are well networked across the state of Wisconsin and working with legislation on setting certification standards. However, Wisconsin Family Ties goes beyond that. We work on policy and legislative changes. We do a lot with adult education, certainly parents, but also teachers, school administrators, and professionals. We host the Children Come First conference. Before the pandemic, we usually had about 1,000 people in attendance from across Wisconsin. Now we do a hybrid program, so in person is a little closer to 500. We are firm believers in family-driven, youth-empowering care, and we have been here for more than 35 years. So a long history of making a difference. You could change the slide for me, please. Great, so this is a little bit about me. I'm not going to read all that text. That's too much for even me to read. But I'm just going to tell you a little bit about the work that I do. My second career has been in research specifically for children's mental health issues. And so I do what's called primary research and secondary research, which means that I connect with organizations and entities outside of Wisconsin Family Ties to gather information and then to help organizations process information. So for instance, I've worked with Department of Public Instruction or Department of Health Services. Also, a large part of my job is internal assessment or evaluation. So examining the programs that we offer to check on effectiveness, but also other things such as how is our training doing? How is our board doing? Really doing some introspection on the organization to be certain that we're functioning as well as we can be. But the most important qualification that I bring is that I am a parent of a young man with a mental health condition that started at age 3, or at least we first recognized it at age 3. So I have a lot of personal experience with systems, and I bring an enthusiasm for changing and improving systems to my research work. So if you could go ahead and switch. So our agenda for today, at first I'm going to go over terms and purpose with you. I am going to talk about ready-made instruments. Some of you will be interested in that because they're easy. They exist, they're standardized. You can simply adopt them and move forward. Sometimes there are unintended consequences to that. So I want to call your attention to some of the roadblocks that might be in your way that you're not expecting. And then I'm going to talk with you specifically about how do you pick the right assessment instrument for your program. So I'm going to use an example from Idaho, and then I'm going to use Wisconsin Family Ties as an example to talk about the mission of our program, not the organization, but the actual program. And then I'm going to walk you through our process as an organization. We will have a couple of surveys. We're definitely going to have some group discussion time. And if you're interested in references, they're at the very end of the PowerPoint. So if you could switch the slide. All right, this is our first survey, and I'm interested in knowing, in the past year, I can't read that. Whom have you surveyed for feedback regarding your parent-peer specialist program? So you'll notice there are a number of different options. There are parents who received services, children. Are you connecting with organizational staff about the program? How about your board of directors? So if you could kind of vote, check all that apply, and that will help me to know what kind of breadth you have in terms of assessing your programs. So it looks like 100% of you are checking in with parents who receive parent-peer specialist support services. So that's huge. Well, it was 100% at one point. We're down to 70. Some of you are doing the children and youth who receive services. That's always impressive to me, because in order to do an assessment, you have to be especially careful about HIPAA and other laws related to connecting with children. Organizational staff, about 20% of you. That's good to see. Board of directors, not so much. And organizations that support your family, we've got about 20%. So it looks like many of you are connecting with a variety of stakeholders about this one program. That's always a good sign, because if you get consistency across stakeholders, that helps to ensure that your information is reliable and valid. So if we could take a look at the next survey.
So do I have to end this or X out of it? There we go. Got it.
Right, so if you can think about the stakeholders that you just acknowledged in the survey before, how many of those stakeholders, or what percent of all of those stakeholders, get a follow-up communication from you after they have completed a survey or after they have completed an informational interview? So what percent of them are receiving either a letter or an email that says, this is what we found, thank you for your participation, and this is how we're going to use the information? So a number of you are at 75 to 100% of those stakeholders are getting follow-up communication. That's really important. It's still kind of shifting, blipping around. We'll talk a little bit more later in the presentation about the importance of closing the loop, or ensuring that you've really brought a study or an assessment to full closure, and how that will impact your participation rate the next time you move forward with an assessment. So it looks like about 25% aren't doing any follow-up. In the end, we've got about 17% that are doing follow-up with 75 to 100%. And then the rest of you are kind of in the middle somewhere, with most of you communicating with about 25% of your stakeholders. None of that is surprising. As people become more accustomed to taking a look at output and outcomes, which we'll take a look at in a minute, they're starting to realize the importance of closing the communication loop. So we're going to talk about that today as well. If you could skip to the next slide. So why measure? Why measure it all? And this topic I covered a little bit more extensively in the February assessment. I'm going to talk about why we measure from a slightly different perspective this time around. And I'm going to keep it really simple. So some of the explanations I'm going to give you are going to be relevant no matter which stakeholders you're talking about. So Lori, if you could flip to the next slide. So really there are 3 reasons that you should be doing an assessment. And the first is to check in and say, are we doing what we said we would do? Are you doing what you told the funders you were going to do? You're doing what you told the parents you were going to do? How closely are you aligned? How closely are your actions aligned to your words, to your mission, to the other statements that you make? So we want to know if we've got compatibility there. And then we want to know, are you doing it well? So can you assure us with some sense of validity and reliability, which simply means consistency in measurement? Can you assure us that you're doing a good job of it, that you're getting an A+ rating? And then the final purpose is really to be able to share that information. Who should know about your triumphs and challenges? You are going to be learning about your triumphs and challenges as you assess whether or not you're doing what you say, and as you assess how well you're doing it. Who needs to know? Does the board of directors need to know? Do your service agencies that you work with, do they need to know? Do both of those groups need to know the same information? Or is your communication with them going to be tailored so that they're getting information that they are specifically interested in? So in order to discuss research, we need to come to an understanding about key terms. And the first one is output and outcomes. And I know most of you have been hearing those buzzwords because they are coming from our funders. They not only want to know what the output is, in other words, what have you been doing? How many meetings have you had? How many webinars have you held? What populations are you working with? That's your output. That's what the organization is doing. They also want to know about outcomes. So they want to know, what difference did that action make in the world? And so outcomes often have to do with your vision or your mission and with the change that your organization intends to make in the world. We're going to come back to that again in a little bit. In essence, there are several types of data, just to refresh your memory. There's qualitative data, and I tend to think of those as stories or inspirational vignettes. It helps us to get kind of a depth of perspective about what's going on, what's meaningful in your program. And then we have quantitative data, which is in essence numbers. What % of your community agrees that they have improved as a result of the communication? There's also an interesting way to get at quantitative data, and that is to use qualitative data. So for those of you who right now are just simply collecting stories, you can actually turn some of the information in those stories into quantitative data. And you can do that through something called a thematic analysis or content analysis. You can look for how many people brought up a specific word, let's say juvenile detention. And so you begin to take these stories and move them into numbers, number of people who brought those up. We're also going to talk about venues. So we're going to talk about focus groups, face-to-face contacts, phone calls, email, US mail. Interestingly enough, your decision on the venue can significantly impact the diversity of your respondents. So in other words, those constituents who are normally underrepresented in organizations, minorities, lower income, lower education, you can impact your response rate from them by taking a look at how you're communicating with them and what you're doing. So we'll be talking a little bit more about that as well. All right, if you could switch to the next.
Did I go too far?
Yes, you went too far. It should be ready-made. It should be a 3-part grid. Back further to right there. Oops, one more forward. Ready-made instruments. So many nonprofits are particularly interested in ready-made instruments. Is there something out there that I can use, that I can grab quickly, that's going to make it easy for me to measure what I need to measure and to get the information that my stakeholders need to them in a way that they understand? So what I have provided here is just kind of a quick overview of a couple of different instruments. You'll see the family journey assessment, the caregiver strain questionnaire, and family empowerment scale. Those are just 3 examples. And I've given you a quick description, instrument cost, what's up with training, who your audience might be, and your timeline for proctoring. The purpose of this grid is not to finalize your decision in your assessment interest, but to give you some focus and help you determine where you want to explore and invest some time and energy. I've developed a handout that you can access. It's at the Wisconsin Family Ties site, and it includes more than 10 ready-made instruments. I think Lori's going to put that in the chat, but if you want to just directly connect with that handout, it's at www.wifamilyties.org/research. So these information bits are really kind of a teaser to help you decide if you'd like to do a more in-depth look at those instruments. All right, if we could go to the next. So as you are looking at the 10 plus instruments that are on our Wisconsin Family Ties website, it can become overwhelming. Which elements should I be comparing and contrasting? These instruments are different, some are similar, many are very different. What should I be looking at to determine if a ready-made instrument is right for me? And there are 2 factors that you should consider. One is the instrument that you're looking at compatible with the domains of your parent-peer specialist program? And I'll talk about domains in a minute. Is it compatible with the model that you use for parent-peer specialist programs? So as you're doing a deeper dive into some of those ready-made instruments, ask yourself that question. Try and locate their model, locate their domains. That information is in their summary information and will be incredibly helpful for you. So my first example on this sheet is a process. Some organizations for parent-peer specialists will talk about working with self or with the parent. As that becomes more manageable, they move forward into more of a family approach. And then they might even move into a community approach where they're mobilizing parents and families who use the system in order to make a community difference. So if that's your model for your parent-peer specialist program, that should be reflected in the assessment instrument that you pick. Underneath that is a grid of domains. And this is actually from the Family Empowerment Scale. They talk about family, service systems, and community or political arenas. So what's happening in those areas? And then they work through those particular areas by looking at attitude, knowledge, and behavior. So what is a family attitude in terms of empowerment? What is their knowledge base? What are the behaviors that you can see? That's just, again, another example of a domain that you might find as you're looking through those ready-made instruments. It's a quick and easy way to help you kind of filter through what might work for you and what might not work for you as an organization. We're all different, so there isn't going to be just one standard tool. All right, if you can move to the next one. So I mentioned that oftentimes there are unintended consequences. If you are an organization that really has not yet systematically gathered information on your peer-to-peer specialist program, you need to think seriously about key issues that are headed your way. For instance, what are you going to do about data storage? You're going to use an Excel spreadsheet if you're a small organization. If you're growing and a larger organization, do you need to take a look at some specialized software, something that allows you to manage relationships? Wisconsin Family Ties went through this assessment a couple of years ago. We made a decision to use Salesforce. Our unintended consequence, we realized, was that Salesforce is not particularly set up to allow for assessment data or the storage of assessment data. So for us, that will be a phase 2 modification of the implementation of a data storage package that we're using. You'll also need to consider, if we're going to do data collection, if we're going to use a ready-made tool, what is this going to mean in terms of staff training, proctoring, and who's going to enter the data and assess the reports? As you take a look at that handout on our website, you'll see that some of the ready-made instruments might be free of charge, but they have extensive certification requirements that have to be renewed every year. So there is a charge associated with that instrument. You need to think ahead. If you have been gathering data and you're taking a look at switching instruments to something that's more appropriate or something that's going to help you look at outcomes for your funders, in other words, the difference in the world that you made, you want to take a look at longitudinal data. So historically, what have you collected and what kinds of comparisons do you make year to year? You're not going to want to lose that valid information. So you may want to come up with a transition plan that allows you to head into this new ready-made tool while at the same time continuing to collect bits and pieces of the data that you have collected in the past so that you can transition your communications with the people who matter. There'll be things like organizational infrastructure. Are you going to need to create a manual? What is it going to mean to staff hiring? How are you going to communicate with stakeholders? So depending upon the instrument that you choose, is it simple enough? Are the results simple enough that you can just directly share that with stakeholders? Or are you going to need to do some translating? There's always the issue of tech support, certainly hardware, but most importantly, and I can't emphasize this enough, is the unintended consequence of using an instrument where the tail ends up wagging the dog. And let me explain what I mean to you about this. If you rush through your selection of an instrument, and it might be that you decide a ready-made instrument plus your own questions, so you're going to do a blend. Whatever is on that ready-made instrument, whatever questions exist there, whether or not they align with your program, if you choose to ask them, your program will likely eventually change so that your scores in those areas can increase. So let me give you an example. It may be that your peer-to-peer specialist program doesn't particularly interface with the juvenile justice system. And that's not a direction that you want to head, and that's not really data that you want to collect. But that may be part of this ready-made instrument that you select. And so you may find yourself collecting that data, even though it's really not particularly meaningful for you. What will happen over the years as you get new people on board, as staff change, as the organization shifts, you will find that suddenly your organization does care about that score because you're reporting on it every year. So even though initially you weren't interested in the information, initially it wasn't something you wanted to track, it wasn't a support service you were going to offer, chances are you're going to steer your organization in that direction if you're not careful. So even as you're picking out a ready-made instrument, something that will be quick and helpful and you can proctor on a regular schedule, you may want to modify that instrument so that you don't end up in a position where the tail is wagging the dog, so that you're always 100% certain of who you are and what you want to measure and what you want to be successful at. So just a few things to keep in mind as you're reviewing that ready-made hand sheet that I passed out. Additionally, you will want to keep all of this in mind if you intend to do focus groups. Do you want to meet with current parents and find out what's important to them, or do you already know what's important to them? Do you want to do a focus group for people who pay for services and find out what they're looking for? Do you want to blend that with other instruments? So you may choose to do some independent work to develop a customized instrument, or at least a portion of a customized instrument, and blend that. Even so, you need to be aware of unintended consequences. So if you could switch to the next slide. All right, so here's an example of a mission statement, and I use the term mission statement loosely. What I really mean is program definition from the Idaho Department of Health and Welfare. And this defines their Certified Family Support Partners program. So it's basically what we as Wisconsin Family Ties call the Parent-Peer Specialist program. And if you look at it and skim through it quickly, you can see it gives you some important information. It talks about what they do, and it talks about, in essence, how they're going to do it. The secret, though, the secret in assessment and in evaluation and deciding how you want to move forward as an organization is actually written in that mission statement. So as a leader of your nonprofit, this is probably how you see what they have written. But as a researcher, when I read through that statement, what I see looks a little different. And so if you can flip to the next slide for me, I'll show you a little bit about what I see. So the information on the left is, in essence, an exact copy of the information from the other slide. But what I see is a breakout of important measurements and commitments that this organization has made, and therefore that this organization needs to measure. Remember, the purpose is, are you doing what you say you're going to do? Are you doing it well? And who needs to know? So that first red section of this information, that's really about the hiring process. As a researcher, I might choose to work with the parent-peer specialist leaders and do an assessment of their hiring process to be certain that they are aligned with this portion of their statement. But as a program assessor, one who's looking at output and outcomes, for me, at least in this moment, that's not relevant. So I move on to the next section, which talks about what the program offers. And it's offering hope and encouragement. That is what our organization, or the Idaho organization, is saying people will receive if they connect with the organization. Hope and encouragement. So as a researcher, I'm starting to think, okay, well, how am I going to measure hope? How am I going to measure encouragement? Those are what we call latent variables, which means it's not something that you can take a ruler and measure. You have to do something a little bit more sophisticated to get at the notion of whether or not you're offering hope and encouragement. In this particular situation, Idaho makes it a little bit easier because they say how they're going to do it. They're going to do it by sharing their experiences and knowledge. So sharing experiences and sharing knowledge are a little bit easier to measure. Have your PPSs shared their personal stories or shared bits and pieces of it? Or more importantly, do your parents who are receiving the services feel that they have heard stories about their peer specialist experiences? Do the parents who are receiving services believe that their knowledge has increased? Have they received more packages of information? Have they learned more about systems that they didn't previously know about? So giving and receiving also needs to be a part of your assessment tool. You need to know who you're serving. And luckily, again, Idaho has outlined this pretty succinctly. They say they serve individuals, they serve families, and they serve communities. The drawback to that statement is they have 3 distinct populations that they need to assess. So they are not just looking at an individual parent. They are going to need to interview or survey parents. Then they're going to need to come up with a way to interview or survey families, and then to do the same for communities. The purple is kind of a mixed blend. It tells you what the parent peer specialists are going to do. Some of it's easy to define and some of it's not so easy. Usually it's easier if it's output. How many packets did you distribute? How many webinars did you hold? It's a little bit harder if it's outcome. Did they get hope? How do you know what hope is? And how do you know if they have increased hope? So we're going to talk about that a little bit more in a minute. If you could click to the next slide, please. This is a survey, and I'm just kind of interested in learning about how well you understand output, outcomes, and demographic information. And I'll give you a hint. Demographic information is things like age, gender, zip code. So it's defining characteristics of a population. So I'd like you to take a minute and read the variable and decide if you think that's an output, outcome, or demographic. And you might think it's more than one of those categories. That's fine as well. But let's take a minute and see where you all are in terms of understanding these concepts.
Bridget, can you put up this survey?
I thought we were gonna do chat emojis. I'm sorry.
Okay, so I'm sorry. Maybe I misunderstood. Robin,
I
what would
can
you
move
like us to
forward.
do?
I can move forward just the way we are. And I'm going to start from the premise that most of us get confused about output and outcome, especially because they're newer terms. And I have to tell you, as a researcher, sometimes I get confused and I have to take a magnifying glass and think, all right, so what is this? Is it output or outcome? So remember, output is typically, what is the organization doing? Can you count it? Can you measure it? And outcome is, what is the difference that you have made in the world?
We can have them put their answers in the chat if you want.
Oh, okay,
So
let's
you
do
can
that.
move away. Okay. So on the first one, number of peer specialist interaction with a parent or guardian, would that be an output, an outcome, or a demographic? Output? 2 outputs?
2 outputs, more
3?
outputs.
Yeah.
Yeah. Give it just another minute. Okay. That's great because that is exactly what it is. It's an output. It's telling people what your organization did and how they did it. It could also become demographic information. Depends on how you use it. So if you're asking the question, it's an output. But if you're using the information to set aside a group of people, it becomes demographic information. So let's say I want to run a focus group, but I only want peer-to-peer specialists who have interacted with a parent or guardian more than 50 times. Now I'm describing the trait of a population. So I'm going to pull those people away from everybody else. So you can take an output and use it in a different way, and that kind of changes what it is. However, for this particular variable, output is what I would go with. All right, what about an address of high school? Demographic. Anyone else? More demographics? Right? It's exactly right. You can use it along the lines of a zip code. So, how are you going to define a population? You might decide in your research that you're going to compare high schools. You're going to compare the results of the parent-peer specialist program at Nicolet High School to the results of the parent-peer specialist program that was offered at Homestead High School. So it's a demographic. It's a way to help you think about population. What about parent empowerment? Got an outcome. It's exactly right. It's an outcome. And it's a tough outcome because you have to decide how to measure it. One way that you can do that, if you choose to create a portion or even all of your assessment instrument, is to take a look at the literature. So you actually would need to do a bit of research, how historically are organizations defining empowerment. So if you were to do that kind of research right now, you would find some information about how parent-peer specialist programs define empowerment, but you'd find a lot of information about how schools define parent empowerment. So you don't necessarily need to restrict your research to just one subject matter. It all becomes important. Student understanding of their mental health conditions. Would that be output, outcome, or demographic?
A couple outcomes came up.
Great. That's exactly right. That's exactly right. What about number of webinar classes hosted for teachers? The trick there is number. Yes, great. Output or demographic, depending upon how you use it. So Tony asked if empowerment, parent empowerment, could be used as a demographic. And yes, it could. So if I am researching parent empowerment and 5 years from now, I decide to take a group of parents who scored 10 on parent empowerment, that now becomes a demographic variable. So that's exactly right. It can depend on how you use it. But the importance of understanding if it's output or outcome is that it helps you to determine which information you want to communicate with a different stakeholder. I often find board of directors are more interested in output. They want to know how many webinars you had, how many fundraising events you had, what was the dollar amount. Funders are increasingly interested in outcome. Now that's a gross overgeneralization, and I won't defend it. I'll just say intuitively that that's been my experience. And then the last one is caregiver stress. And again, somebody started already. That's exactly right. It's outcome. It's outcome. Unless eventually you say, I only want people with low caregiver stress to be involved in this focus group. Now you're talking about it as if it were a demographic. Great. Can we move on?
Okay.
Okay, so this is a draft of the Wisconsin Family Ties Parent Peer Specialist Program mission. It's a draft, and if you read through it, you and anyone else would see the black and white words, and it would kind of walk you through what it is. Again, as a researcher or as someone who's trying to decide how you're going to assess your program, you might see it differently. And so if you can flip to the next slide, this is how I see it. And I have to tell you that this is how I see it now. But when I first joined Wisconsin Family Ties, these factors were far more broad and diverse than what is currently listed here. So in order to reach the point where we were able to do a program assessment, we had to tighten up what we meant by our parent peer specialist program. And that may be a process that some of you have to go through as well. One of the issues that we looked at was our impact on children versus our impact on parent, which was more important, which was least important. Taking a look at who we were hiring and their profile, we really needed to define what our hopes were for these parents, because our materials typically talked about walking with families as they navigate the complex services and systems. Well, what does walking with a family mean? So we had to get a little bit more specific, because I can't measure walking with a family if I don't really know or understand what it means. What we decided as an organization is it means to provide emotional support in part, and then it also means to foster parent empowerment. So as a researcher, I'm looking at this, we finally get consensus from the organization that yes, this is what we're doing. This is really what we want families to end up with. We want families to be empowered so that they can manage a life with a young adult, future young adult with a mental health challenge. And we want families to feel emotional support and eventually to figure out how to get their emotional needs elsewhere. So you'll notice that the last sentence is, as parental empowerment increases, WFT specialist support aids. So now this is giving me something to work with. So I've got the term empowerment, highly trained parents. That allows me to build an instrument to check on training and hiring processes, and emotional support. If I wanted to, I could go and select a pre-made instrument. And in fact, that is in part what we did. Wisconsin Family Ties decided to use a portion of the FES, which is the Family Empowerment Scale. There's always controversy in any instrument that you use, including the family empowerment scale. So we had to be prepared to defend our choice in that instrument and prepared to clearly outline what empowerment meant. But we've got a running start now. We have a clear understanding of what our program is, and we have identified key outcomes that we want. My guess, if I had to make a guess, is that this might be a call to action for many of you. That as you're looking at how to assess a program, you may want to start by going back and taking a look at your program's mission. What are you doing? Why are you doing it? In the end, how will the world be changed? How will these parents be changed? How will these families be changed? And so doing an analysis of your mission statement is a great place to start, even as you're also beginning to look at some of those ready-made assessment instruments. So if you could move on to the next slide. So before I even got to the point where we realized we were interested in the FES and then also in customizing it, I realized we had some internal challenges. So we had very specific expectations of different functional areas within the organization. The organization was adamant that Wisconsin Family Ties was our program and our way. And we would not be accommodating to just random certification standards. We would not be willing to adjust or change our program in any way whatsoever in order to improve a score or broaden or be more inclusive of categories. So that was one. It's our way or it's the highway. We don't want an instrument that's going to be the tail wagging the dog. Our other truth became that the parent's truth is the truth. So in other words, our reliability and validity testing, which you'll learn about as you're going through the ready-made assessments, was handled differently because our only interest was in what does the parent think, what does the parent believe, how is the parent feeling? That gave us some flexibility in terms of how we were measuring. So if a parent said they had an increase in knowledge, we didn't have to measure that any other way. We could assert the parent, him or herself, is stating that they have an increase in knowledge due to information provided by Wisconsin Family Ties. That is a truth. That is an outcome. And that is something that we can verify. So in some instances, the way that you define components or aspects of your organization or of your program can change what you need to have on your assessment instrument. We were concerned about what kind of an impression a pre-test would do or would make on our parents. Our organization is adamant that we are not a clinic, we are not clinicians, we are parent peer specialists who can advocate and travel with the parent to provide emotional support. So one of our issues was if we do a pre-test or if we do a pre-test within the first few appointments of a family's connection with the organization, it's going to end up having a clinical feel to it. So that was a hurdle that we needed to work around. And we were able to do that through some customization of reports that our parent peer specialists fill out. They don't fill them out in front of the family. The parent peer specialist has roughly 30 days to enter in certain key data. And they do that without a formal outcomes assessment or a baseline report. So we get the information that we need, and then we structured our outcomes assessment so that it had a baseline built into it. And I can talk a little bit more about that in a minute. Cost and training needed to be minimal for our organization. We needed immediacy of baseline data as part of what I've already discussed with you. And one of the ways that we got around that was to talk about asking the parent in comparison to when I first connected with Wisconsin Family Ties, and then having them give the follow-up assessment. Because our organization believes that the parent's truth is the truth, that becomes our baseline. We know that that slightly decreases our reliability. If you take a look at traditional research methodology, but it was a minor decrease and something that we were willing to tolerate. So how do we engage families in taking these assessments? How are they changing? That was also part of our organization-wide discussion as we're taking a look at how we're going to measure. If you could switch to the next slide. So we took the FES, which is on that handout, and we modified it. We made it our own. We changed some of the phraseology so that we could get the baseline. We inserted since connecting with Wisconsin Family Ties. We stacked the assessment so that every year we could modify roughly 4 to 5 questions to get at information that had suddenly become relevant to the organization, but had not been previously relevant. That meant, though, that there would be no longitudinal data on those new questions. Still, we wanted the flexibility to be able to do that, and we structured the assessment instrument so that when we are ready to customize our Salesforce software program, it will blend seamlessly. What we did not do with the FES was review it for cultural sensitivity, for inclusion of populations that are underrepresented. And that is a problem for us. The FES was originally developed in the early 90s, before really sensitivity had become the norm for those topics. So we do find ourselves with some challenges related to that. It's an ongoing work to increase sensitivity, to increase inclusiveness. And so as we make changes to our instrument, we're modifying that. We're also creating focus groups with people to determine how do we make this more meaningful for you? How do we make it more meaningful for your culture? This is especially the case as we're headed into developing a special program for the Hmong population in Wisconsin. Unfortunately, this last year, we learned the hard way that the venue significantly impacted the participation rate of our underrepresented families. This year, for the first time, this past year, we went with an online survey instrument. In the past, it had been telephone calls. My interviews lasted typically an hour per family. I often interviewed 40 to 50 families per year, per month-long cycle. I got some great information. And I got more than 75% participation, in part because we leveraged our parent-peer specialists. We knew we were going to have trouble with minority populations, with the trust factor, screening numbers, not accepting calls where they don't know the number. So we spent time I spent time working with parent-peer specialists who had families in those demographics, meeting the families, having the parent-peer specialist talk with the families about who I am, what my role was, level of confidentiality. In many instances, there was concern about the probability that I would contact Child Protective Services, what that meant, what that looked like, and then kind of greasing the skids for me. We thought that with this online methodology, we actually were going to extend our reach, and we made accommodations for problems that we anticipated. So we also had pencil paper versions. We also used our peer-to-peer specialists to leverage participation. It was ineffective. And so what we ended up with was a very homogeneous group of respondents. The good news is that's all the catalyst I need to take a harder look at what we're doing in terms of assessment and how we are going to more fully engage not just the families who are currently using us, but the families who could be using us and aren't for whatever reason. Timing, we have varied that. Initially, we did it in the spring, thinking that's easier for the families to fill out. Then we noticed it was better late fall because that's when funders want their the readings on their work. They want to know what the outcomes are. And obviously, we instituted different validity and reliability measurements. So one of the things that you may want to consider as you take a look at those instruments that I've mentioned is what kind of sensitivity do they have to cultures, ethnicities, and race? And what was the process that they went through to get that sensitivity? It's easy to say you're sensitive to something, but if you haven't gone through proper methodology, if you haven't really crossed your T's and dotted your I's, it's probably not valid to state that you are sensitive. All right, we can move to the next. And this is really my final slide, and it's about closing the loop. I mentioned that earlier. It's incredibly important for the people who participated in your research to get feedback from you that they heard you and that you're using the information. We typically go with confidential or anonymous surveys. So our outreach to people post-survey is generic in nature. And we make a point to tell them not only what the results of the surveys were, but what we're going to do with that information and why we aren't using some of the information that we've received. We also we do quantitative and qualitative analysis, which allows us to focus program structure for improvements for the next year. It allows us to focus assessment instruments for the following year that will address some of those. And we customize our communications. We communicate with staff, typically in person. We share relevant information with donors. So I work directly with the development office. Not all stakeholders are interested in all the information. So personalization is key. So that kind of takes you through a process that might be helpful for you as you select an assessment instrument for your peer-to-peer specialist program, or as you create one yourself. Probably the first point of action is going to be taking a look at that mission statement, simultaneously taking a look at that worksheet that is on the Wisconsin Family Ties website. So the next slide is actually conversation points. And if you could skip that one, that NTAC inadvertently put that in. So this is the next slide. And I'm interested in having people share, how do you currently measure program outcomes and what are the pros and cons? I'm especially interested in knowing how inclusive your assessments are of diversity. And then do you have helpful hints for the rest of us about how you gather, analyze, or interpret, how you do your outreach? So if you can share with us so that we all can learn some of the tips and tidbits that you already know. So I think we're going to break out into a couple groups. we're going to take maybe, Lori, I don't know, maybe 10 or 15 minutes to share
Yeah,
and then come back.
15, yep, 15 minutes, yes. And
Sure.
know that we have 5 minutes left, so.
Oh, wow. All right. I'll try to break it down because I got the gift of gab. But in our group, it was amazing. We talked about different ways to save or gather data, as well as different techniques used to what's the word? I forget. I'm sorry. I had got COVID and I had this brain fog thing where I forget. It's crazy because I've never had that before. But in our group, and then we talked about different methods. I guess there's different ways that we can gather the data, and what was the pros and cons of that.
Mhm. Great.
Robin, in your group?
Well, our group covered actually a fair amount of territory. We talked about the programs and what's happening specifically within the programs, program management, new programs who are just getting up and expanding versus those who've been around a while and are trying to work through a bureaucracy of the state. And really just kept coming back to the fact that it's going to take some introspection about what exactly it is you need, and really some collaboration to bring your teammates on board as you make a decision. So the people in my group felt like the most helpful part was really talking about potential glitches, unanticipated consequences, and
Sure.
being able to spend some time looking at that. So
Good.
I
I think-
announced to my group and want to make the same announcement to everyone that if you are interested in talking, if you would like more information, please just give me a call.
And here is her information. To finish up this session, thank you so much for all of your participation. You'll see in the slides here are the references that Robin talked about at the very beginning of the presentation. So you'll have some of those. Also, know that we are not having a family exchange in November and December due to holidays, but the next one will be in Wednesday, January 25th. And we'll have a topic out ready for you by then. And this slide will show you all of the NTAC information. Before I want to thank NTAC and Bridget for being our tech support. But I also want to thank a big hearty thanks to Robin for all of her work in bringing this information to you. Hopefully it was helpful. Hopefully you have a call to action that you know what you're going to do now and how you're going to collect your information and what it is that will help your organization be better. Also, if you have any topics for future family exchange, I'm just putting together my schedule for next year. Anything that you would like to know, I've got a couple of things in the chat from my group, but the other group didn't have that opportunity to do that. So either email it to me, put it in the chat quickly. Anything that you can think of, I'm more than happy to bring information. I would love to bring information that you will love to hear about. So thank you so much for your time today, everyone. And I hope you have a great day. Thanks, Bridget. Bridget will send out an email with these slides so that you'll get all of the information in the next couple of days. You'll get that. So thank you, everybody, and have a great day. Thanks, Robin. Thank you. Thank you.